My name is Dr. Caroline Watson. This is a surgical video series that I am starting to put together. The point of this series is to showcase challenging cases. This one in particular is managing a small pupil without a malayugin ring. We don't use them very much during my training, and this is an example of how to manage a case without one. I think I've watched my mentor do several thousand cases over the past couple months, and I think I've seen him put in 2 rings, and so you tend to learn how to use what you have. Obviously, this person received femtosecond laser treatment for the cataract surgery, so I know that at the very least he has the potential to dilate to about 4.8 millimeters. The capsulotomy is about 4.5 millimeters. I'm just injecting viscoelastic to viscodilate and just going ahead with my normal hydrodissection rotation. And then I'm going to insert my bimanual irrigation chopper along with my 20 gauge sleeveless phaco needle. And the key with managing these small pupils, obviously you have a lot more control over the stability of the anterior chamber with the bimanual instrumentation. I'm just being super careful to obviously not nick the iris or the anterior capsule, and I am going a little bit underneath the iris edge with kind of a blind groove there. I'm just slowly grooving all the way down until I'm able to rotate and spin the nucleus around, trying to make sure that I get a really good groove. And as well, the femtosecond laser has already made it easier for me just because I know it'll crack much, much easier in a situation like this. So, we rotate with both instruments, and then we go for more of a 45-degree angle to make our first segment and then crack it. And luckily, I've been able to maintain a lot of stability in the same size pupil for the majority of this case up until this point. So I'm just slowly getting the first segment out. It's actually cooperating pretty well. And I am just gently rotating the phaco needle around, spinning it, making sure I get all the pieces, turning to my right as well, making sure I get a really good grab on that next segment, bringing it up into the AC past the pupillary margin, and also just very carefully making sure I'm not hitting the endothelium and making sure I'm using my irrigation chopper to break up the pieces and sort of feed them into the phaco needle as well. The last move that we do is pretty much grabbing that other hemi and either chopping it if possible or just very carefully chopping pieces off with the irrigation instrument. And luckily, this pupil maintained its shape, and you can really appreciate how the bimanual technique allows us to have a lot more control over the eye in a situation like this, and doesn't necessarily make it to where you do need to have a ring to use to dilate the pupil. Going in with my diamond dusted INA tip from MST instrumentation, and these Cortex pieces are coming out pretty easily. A lot of times with the femtosecond laser, we end up with a really big shell, mostly from the hydrodelineation that we do. So sometimes that can be a little bit more challenging to remove. But in this particular case, it came out pretty easily. And I'm just trying to maintain my left-handed instrument in the eye to make sure that I continue to have that stable anterior chamber, and then very carefully trying to get that very last piece of cortex out without grabbing iris like I just did there. and unfortunately it does end up coming out all together. Now you can really see that the pupil size is very, very dependent on my irrigation. And you can see I stopped irrigating as I'm injecting the Amvisc right here. And you can just see how tiny this pupil really is. Here we are injecting an Acryos lens from Bausch & Lomb. It's a really great lens, and we use it a lot in most of our standard cases. And I'm just very carefully putting it in the bag, getting it under the pupil margin, and checking to make sure that everything is where it should be, and getting all of that viscoelastic out. And this patient ended up doing quite well. As you can also see, there was no iris prolapse, and we were able to finish the case without any assistance with any other instruments. And these cases can be obviously very challenging. And hope you guys enjoyed watching. Come back for more.